Hello everyone. In this session, we'll be learning about the mammary gland, also referred to as the breast. This topic may be asked to you as a long answer question in upper limb anatomy. Okay, so if examiner wants to ask any other topic apart from joints and nerves, this topic is usually considered because the cases of breast carcinoma are on a rise and as per competency-based curriculum, you may also expect case-based questions on this topic. Okay, so this is a very important topic to be learned. Okay, so let's begin. Let's begin with our first heading, location of mammary gland. Where is the mammary gland located? It is present in the superficial fascia of pectoral region. It is present in both males and females, but it is well developed in females. Okay, and it is considered as a modified sweat gland which is present in the superficial fascia of the pectoral region or the chest region. Okay, and what is the horizontal extent of mammary gland? It extends from the lateral border of sternum. Okay, if we consider sternum bone here, okay, the lateral border of sternum and to the mid axillary line. Okay, there would be mid axillary line at the level of axilla. Okay, so mammary gland extends between these two parts. Okay, and vertical extent is between the second to the sixth ribs. Okay, so second rib, sixth rib. Okay, vertical extent, and we can see a part of mammary gland in the superolateral part that is going towards the axilla. Okay, so there is a small extension called as axillary tail of Spence that pierces the deep fascia through an opening which is called as foramen of Langer. Okay, so here we can see one opening here, that's the foramen of Langer through which mammary gland is extending into the region of axilla. Okay, then relations of mammary gland, posteriorly it is related with the retromammary space. Okay, so you can look at this diagram. This is the mammary gland behind which there is a space called as retromammary space, and there is a fascia covering a muscle called as pectoral fascia, and the muscle itself is the pectoralis major muscle. Okay, so all these things are there in the posterior relations of the mammary gland. Now let's come to the structure of the mammary gland. So basically it has got three main components: skin, stroma, and the parenchyma. Okay, so structure of mammary gland divided into three heads. So let's start with the first head. Skin has got these features. It has got nipple at the level of the fourth intercostal space, and it contains smooth muscle fibers. Okay, then the area surrounding the nipple is referred to as areola. It is a darkly pigmented skin. Okay, and it contains modified sebaceous glands. They get enlarged during pregnancy. That is referred to as Montgomery tubercles. Okay, so this was about the skin. Okay, stroma or the connective tissue, it consists of the suspensory ligaments of Cooper that is arranged radially that connect the dermis of the overlying skin to the ducts of the breast and the pectoral fascia. Okay, and fat, it forms most of the bulk of the breast. Okay, and parenchyma is the glandular tissue. Around 15 to 20 lobes are arranged in a radial fashion. They converge towards the nipple. So one lobe we can see here, there would be multiple lobes like this that would converge towards the nipple. Okay, and each lobe is drained by a duct called as lactiferous duct. Near its termination at the nipple, each duct expands into a sinus called as lactiferous sinus. Okay, that is seen here, lactiferous sinus, the bulge. And each lobe is divided into lobules that consist of cluster of acini. Okay, so multiple acini we can see inside the lobe. Okay, so the structure of the breast we can understand in this image as well. The lobes that forms the parenchyma, in between them the connective tissue is there, that's the stroma. Okay, and outside it is covered by skin. Okay, and diagrams I've mentioned as a special heading because whenever you write the answer, multiple diagrams are expected, so you all can use these schematic diagrams in your answer. Okay, then blood supply to the mammary gland, it comes from this artery, axillary artery. Okay, there are branches of axillary artery called as superior thoracic, acromiothoracic, lateral thoracic branches. Okay, apart from that, internal thoracic artery, posterior intercostal arteries, they all supply the mammary gland, and veins, they follow the arteries. Okay, venous drainage will be according to the arteries supplying it. Okay, then let's look at the nerve supply. Nerve supplies by the second to the sixth intercostal nerves. Okay, they provide sensory innervation to the skin and carries autonomic fibers to the smooth muscles and the blood vessels. Okay, so nerves that you need to remember is second to the sixth intercostal nerves. Okay, the next heading is lymphatic drainage. Mark this topic as very, very, very important, because if we have to ask a separate short note from this topic, then this is the topic which is taken for asking a short note: lymphatic drainage of mammary gland. Because the breast cancer that we'll be learning now, the spread of breast cancer, it occurs through the lymphatics. Okay, so wherever the lymphatic drainage goes, there the cancer cells may go. Okay, so this is a very important topic that you need to learn. Lymphatic drainage, it is further subdivided into two heads: superficial lymphatics and deep lymphatics. Okay, superficial lymphatics will drain the skin except the region of the nipple and the areola. Okay, and deep lymphatics, they drain the parenchyma of the breast. Parenchyma is the main glandular tissue, right? Apart from that, deep lymphatics also drain the nipple and the areola. Okay, there is a plexus called as subareolar plexus of Sappi in the deep lymphatics that will drain nipple and areola, that was not drained in the superficial lymphatics. Okay, and in general, just remember the percentage of the lymph flow: 75% of the lymph, it goes to lymph nodes, the axillary lymph nodes. Okay, lymphatic drainage, this is the diagram that you can draw. Towards the sternum, there is internal mammary lymph nodes. In the region of axilla, there are different group of axillary lymph nodes: anterior, posterior, central, apical, lateral. Okay. Ultimately, everything will go to these nodes, the supraclavicular nodes. Okay. And this initial flow you should know. If 75% it goes to the axillary lymph nodes, 20% it goes to the internal mammary lymph nodes, and 5% it goes to the posterior intercostal lymph nodes. Okay, so whenever you're writing this answer of the lymphatic drainage, this percentage is mentioned: 75% to axillary, 20% to internal mammary, and 5% to the posterior intercostal nodes. Okay, and there is applied anatomy related to it that we'll be learning now. So breast cancer. Okay, the most commonly asked applied anatomy question on this topic: carcinoma of the breast. Case based question can be asked on this topic. So from where does this cancer arise? From the lactiferous ducts. Okay, in the structure we had seen there is a lactiferous duct. Okay, so it arises from the lactiferous ducts, and the patient will present with these clinical features. There'll be painless hard lump in the breast. Breast becomes fixed and immobile. Okay, there is retraction of the skin due to infiltration of the suspensory ligaments. Okay, these suspensory ligaments are also called as suspensory ligaments of Cooper, that if they get infiltrated, then there would be retraction of the skin, retraction of the nipple when there is infiltration, and fibrosis of the lactiferous duct. Okay, the word infiltration means basically the cancer cells are going inside those structures. Okay, then there could be pew, the orange appearance. It's an orangish skin which develops due to the obstruction of the superficial lymphatics. Okay, so these are the clinical features of breast carcinoma. And if breast cancer is there, then it may go in different regions of the body, that is referred to as metastasis. Okay, cancer cells from the breast, it can go to the posterior intercostal veins, to the vertebral venous plexus, to the intracranial dural venous sinuses, and to the brain. Okay, so breast cancer, how, so you may be asked about route of spread of breast cancer from breast to the brain. So this is the route from the breast. It can go to the posterior intercostal veins. Okay, because in arterial supply we had learned posterior intercostal arteries, and there were veins of the corresponding names, right? So posterior intercostal veins, they are connected to the vertebral venous plexus. Vertebral venous plexus is connected to the dural venous sinus. It is present in the cranial cavity, through which cancer cells can go to the brain. Okay, then there's a tumor called as Krukenberg's tumor. So this spread is occurring through the lymph vessels. Okay, lymph vessels from the inferomedial quadrant of the breast, they are connected with the subperitoneal lymph plexus. Okay, Where is inferomedial quadrant? If you have to divide the quadrants, this quadrant is referred to as inferomedial quadrant. Okay, from there, the lymph goes to the subperitoneal lymph plexus. Peritoneal means now it's in the abdomen. Okay, and there is a transcoelomic migration to the ovary. Okay, so ovary can get affected in breast cancer through this lymphatic channels that is referred to as Krukenberg's tumor. Okay, many times an MCQ is also asked, what is Krukenberg's tumor? It is due to metastasis from which organ? So the answer is breast. Okay, then mammography and self-examination of breast is recommended for early detection of the breast cancer. Okay, here as we can see in clinical features, breast becomes fixed and immobile, so that things can be identified by breast self-examination that should be encouraged in females. Okay, and there may be an abscess in the breast, and for drainage of the abscess, radial incisions to be taken. Okay, this is very important because the arrangement of the lobes are radially. Okay, so incisions should also be radial. Okay, because if a vertical incision is taken, then it may damage multiple lobes. Okay, but radial incision will get restricted to one lobe. Okay, so it should be radial incision to avoid cutting the lactiferous ducts. Okay, so this was about the mammary gland. Okay, it is actually a very big topic given in books, but we have done a lot of hard work to concise these notes to present in one page. Okay, make sure you read from these notes which we have made. Okay, link to buy these notes you'll get in the description box below. Okay, thank you.